You know, one of the biggest lessons I've learned as we move into our 60s and beyond is this. More medical tests don't always mean better health. Sometimes they mean more anxiety, more bills, and more time worrying about results that may not even matter. Have you ever walked out of a doctor's office thinking, do I really need all these tests? You're not alone, and that's exactly what we're going to talk about today. This isn't about ignoring your doctor's advice. It's about understanding what's truly necessary for your age, your body, and your goals for quality of life. Because after 60, our health priorities shift. We start caring less about chasing every possible diagnosis, and more about living comfortably, joyfully, and wisely. Today's conversation is about empowerment, about learning when to say yes, this test is helpful, and when to gently ask, is this really needed? Because sometimes the bravest and smartest thing we can do for our health is ask questions. Let's start with one of the most commonly ordered and most misunderstood. Tests for older adults. The PSA test for prostate cancer. Now, if you're a man over 70, chances are your doctor has mentioned this test at some point. It's supposed to screen for prostate cancer. Sounds like a good idea, right? The problem is, after a certain age, that test can do more harm than good. Here's why. Most prostate cancers grow incredibly slowly, so slowly, in fact, that a man in his 70s or 80s is far more likely to die with prostate cancer than from it. But once a PSA test shows a slightly high number, the domino effect begins. More tests, painful biopsies, and sometimes surgeries that can lead to lifelong complications like incontinence or sexual dysfunction. And the truth is, many of those cancers would never have caused a single symptom. I once spoke with a 76-year-old gentleman named Raymond. His doctor ordered a PSA test out of routine. The result came back a little high. So he went through a biopsy, which left him with a severe infection and a week in the hospital. The biopsy found a tiny cancer that doctors said might take 20 years to become serious. Raymond asked a powerful question. If it takes 20 years and I'm 76 now, is it really worth putting my body through all this? The answer, in his case, was no. He chose watchful waiting, and 5 years later, he's still healthy and happy. No more unnecessary procedures. The takeaway isn't to refuse all tests. It's to ask your doctor, given my age and health, would this test change my outcome or just add stress? That one question can change everything. Now, let's move on to another test that doctors often order out of habit. Colonoscopy after 75 colonoscopies can be life-saving for younger adults because they catch colon cancer early. But as we age, the equation changes. After 75, especially if you've had normal results before, the risks can outweigh the benefits. Think about it. Colonoscopy requires anesthesia, which isn't always gentle on older hearts and brains. The bowel prep can be dehydrating, and the risk of complications like bleeding or even a tear in the colon goes up significantly. If you're in your late 70s or early 80s and your past colonoscopies were clear, chances are you've already reaped the benefits of screening. A friend of mine, Maria, had her first colonoscopy at 50, another at 60, and both were perfectly normal. At 78, her doctor suggested doing it again, just to be safe. But Maria asked the magic question. If you find something small now, would treating it even make a difference in my life expectancy? Her doctor paused, checked her history, and admitted probably not. Instead, they decided on a simple, stool-based test she could do at home. No anesthesia, no hospital visit, and perfectly safe for her age. That's the kind of conversation we should all feel comfortable having. Because real health isn't about doing everything, it's about doing what's right for you. And that brings me to another test that especially women over 70 should think carefully about: routine mammograms. I know it feels strange to question something that's been promoted as life-saving for decades, but here's the truth. After 75, routine mammograms often detect tiny, slow-growing cancers that may never cause problems. The real harm comes from what happens next: surgery, radiation, chemotherapy, all of which can deeply affect energy, strength, and quality of life at an age when we deserve peace and comfort. I once met a woman named Elaine, 80 years old, full of spirit and love for her garden. She had a mammogram that found a small lump, which turned out to be a very slow-growing cancer. Her doctor recommended surgery and radiation. But Elaine asked a bold question. If I don't treat it, what will happen? Her oncologist admitted probably nothing for many years. So Elaine made a decision. She chose to live her life. As it was, with regular check-ins but no aggressive treatment. That was 6 years ago. She's still tending her garden every morning, strong and joyful. The goal isn't to ignore cancer or refuse care. It's to weigh the benefits against the burdens. To ask, will this make my life longer or just harder? That's the heart of this message. After 60, healthcare isn't just about living longer. It's about living better. We've earned the right to make choices that honor our peace of mind, not just follow standard procedures meant for younger people. And the most powerful step in that direction begins with one simple habit: asking questions. The right questions turn fear into clarity and confusion into confidence. In a moment, we'll continue this journey and explore more tests that may not always serve you well after 60, including one that might surprise you because it's so common you probably have it checked every year. But before we get there, take a breath. Maybe jot a note or two. This isn't about saying no to doctors. It's about saying yes to your own wisdom. Because after all, this is your golden life, and your health decisions should shine with the same wisdom and dignity you've gained through the years. So let's keep this conversation going. Because the truth is, staying healthy after 60 isn't just about avoiding disease. It's about avoiding unnecessary worry, unnecessary risks, and unnecessary treatments. And that means taking a thoughtful look at what's really needed when it comes to medical testing. Now, one test that many people are told to do regularly, but that deserves a second thought after 60, especially if you're a little frailer or managing other health issues, is diabetes screening and tight glucose control. If you've ever been told to keep your numbers perfect, you know how stressful that can feel. You check your blood sugar, it's a bit high, and suddenly you're anxious. It's changing your diet overnight, taking more pills, maybe even insulin. But here's something your doctor might not emphasize enough. For older adults, tighter isn't always better. Studies have shown that aggressively lowering blood sugar in older patients, pushing those numbers down too far, can actually increase health risks. Why? Because very low blood sugar or hypoglycemia can lead to dizziness, confusion, fainting, and falls. And at our age, a simple fall can change everything. Think of it this way. If you're 70 or 80, and you've lived with mild diabetes for years without complications, your goal shouldn't be to get your blood sugar perfect. Your goal should be to stay steady, to keep it in a range that helps you feel alert, strong, and safe. I remember a man named Thomas, 82 years old, retired teacher, full of stories and laughter. His doctor kept adjusting his medication to hit a specific blood sugar target, even though Thomas felt dizzy and weak all the time. When he saw a geriatric specialist, she said something that changed everything. At your age, we're not chasing perfect numbers. We're chasing quality of life. They loosened his targets just a little, and almost overnight, his energy came back. He stopped falling asleep mid-conversation, started walking again, and even got back to his morning crossword routine. That's the power of understanding what your body truly needs now, not what it needed 20 years ago. You are not a number. You're a whole person, and good medicine should always reflect that. Now, let's talk about something that sounds high-tech and reassuring, but often brings more stress than help: routine CT scans or full-body imaging to check for cancer. It's easy to understand why people want them. Who doesn't want peace of mind? But here's what most people don't realize. When you do a full-body scan, especially after 70, doctors almost always find something. A shadow, a spot, a nodule, things that have been sitting quietly in your body for years, never causing harm. But once they're discovered, the medical system kicks into gear. More tests, more biopsies, more sleepless nights. And here's the catch. Most of those findings are what doctors call incidental. They're harmless. Once they're seen, they can't be unseen. Suddenly, you're stuck in a cycle of scans, follow-ups, and procedures that add fear but rarely add years to your life. I once met a woman named Jean, 79, who went for a peace of mind scan because her friend had recommended it. The scan found a tiny lung nodule, so small it probably wouldn't have grown for decades. But the discovery led to months of appointments, tests, and even an unnecessary biopsy that left her with a collapsed lung. Later, her specialist told her we never should have done that scan. It would never have harmed you. Jean told me she wished someone had told her earlier that sometimes checking for everything ends up taking away the very peace we're searching for. It's a powerful reminder that medicine isn't just about doing things because we can. It's about doing things because they matter. So, before agreeing to a scan or test, just to be sure, ask your doctor, what are we looking for? And if we find something, will it actually change how we treat me? Or will it just create more worry? That one question can save you so much unnecessary stress. And while we're here, let's touch on something even broader, the mindset behind all of this. When we reach our 60s, 70s, and beyond, we've already lived through decades of prevent, detect, and treat. But now, the focus shifts. Now, it's about balance. We not just trying to add years to life. We trying to add life to those years. That means thinking differently about healthcare. Instead of saying, do every test available, we start asking, which tests actually make sense for me at this stage of my life? Because here's the truth. A healthy 60-year-old who walks daily, eats well, and manages stress may benefit from certain screenings that a frail 80-year-old simply doesn't need. And that's okay. It's not neglect, it's wisdom. It's about aligning your medical care with your goals, not your age alone. And maybe that's the most important message of all. You have the right to personalize your care. You don't need to fit into a checklist. You don't need to accept a test just because it's routine. You can ask for explanations, you can ask for evidence, and you can absolutely say, I'd like to think about it. This is your health, your time, your journey. And by choosing wisely, you protect not just your body, but your peace of mind. So as we move into the next part, we'll bring all of this together, not just which tests to question, but how to talk to your doctor with confidence, how to make these choices without fear, and how to stay strong, active, and joyful while doing it. Because after all, the goal isn't just to live longer, it's to live lighter, to carry less worry, to trust your intuition, and to enjoy your golden years with the clarity that comes from being truly informed. Take a sip of water, take a breath, and remember you've already done the hard part. You've lived, learned, and earned the right to choose what's best for you. You know, the longer I've talked with people in their 60s, 70s, and 80s, the more I've realized something powerful. Most of us aren't afraid of aging itself. We're afraid of losing control. We're afraid of being pulled into a system where decisions are made for us instead of with us. But here's the beautiful truth. You can take that control back. You can make informed, wise, and deeply personal choices about your own body and your own peace of mind. And it starts with understanding that medicine should serve you, not the other way around. We've already talked about how some common tests, prostate screenings, colonoscopies, mammograms, blood sugar checks, and even full-body scans can become more harmful than helpful after a certain age. Now, let us close this conversation with what truly matters most: how to navigate your healthcare confidently and protect both your health and happiness. The first key is learning to have open, respectful conversations with your doctor. It's easy to feel intimidated in a medical office. The white coat, the quick pace, the unfamiliar words. But remember, your doctor works for you. You are the center of your healthcare, not a passive participant. When a doctor suggests a test, pause for a moment. Take a breath and ask 3 simple questions. What are we looking for? What happens if we find something? And would this test actually change what we do next? You'd be surprised how many times when faced with those questions, a doctor reconsiders. It's not about defiance, it's about partnership. You deserve to understand not just the potential benefit of a test, but also its risks, the false alarms, the side effects, the stress that sometimes follows. Because too often, people end up chasing results that were never meant to matter for their stage of life. Let me tell you about Harold. He's 84, sharp as ever, and one of the wisest people I've met. His doctor once told him, "Harold, we need to check everything again. Full blood work, scans, maybe a few specialist visits." Harold smiled and said, "Doc, I feel good. I'm gardening, walking my dog and sleeping fine. What exactly are we checking for?" The doctor paused, thought for a moment and said, "You know what? Let's just monitor things and see how you're doing." Harold told me later I didn't refuse care. I just reminded him that I'm a person, not a checklist. That right there is wisdom. You see, real health after 60 is about balance. The balance between prevention and peace, between awareness and overreaction. There's a freedom that comes when you realize that not every problem needs to be fixed, and not every test needs to be taken. Sometimes the best medicine is simply good judgment, rest, and self-respect. But that doesn't mean ignoring your health. It means shifting the focus from aggressive medical testing to active living. Instead of chasing lab results, chase the things that make you feel alive, walking every morning, laughing with friends, cooking healthy meals, keeping your mind curious. Those are the habits that extend life more powerfully than any unnecessary test ever could. And if you do need tests or treatments, and sometimes, of course, you will do them on your terms, ask for clear explanations. Request the gentlest options. Make sure every step aligns with your own vision of what a good, healthy life looks like for you. Because, my friend, your health isn't just a series of numbers. It asks the energy that lets you hug your grandkids, tend your plants, read your favorite book, and watch the sunset without worry. That's the kind of health worth protecting. I also want to say something that might feel comforting. It's okay to say no to a medical test. It doesn't make you irresponsible. It makes you informed. In fact, some of the healthiest, happiest older adults are the ones who've learned to politely decline things that don't serve them. They've learned that wisdom sometimes means doing less, but doing it better. You've earned that wisdom. You've earned the right to ask questions, to slow down the process, and to make choices that protect your peace. And when you do, something beautiful happens. Your doctor starts seeing you differently. You become not just a patient, but a partner. That's when the real healing begins. So as you go forward, remember this: medicine is powerful, but knowledge is power in your hands. Every time you ask a question, you take back a little more control. Every time you say, "Let's talk about the risks," you make your care more personal, more meaningful. And every time you trust your instincts, you strengthen the one thing that matters most: your confidence in yourself. This conversation has helped you today. It's made you think twice about something you've always just gone along with? Then take a moment, give this video a like. Not for me, but so more people your age can find it and feel that same sense of clarity. And if you have a story, maybe about a test you questioned, or a time you decided to trust your instincts, share it in the comments below. I read every single one, and your experience might be exactly what someone else needs to hear to make a wiser decision about their own health. And of course, if you're new to Golden Life, consider subscribing. This channel is all about helping you live your later years with more confidence, more calm, and more joy. Because aging isn't a downhill slope, it's an upgrade in perspective. It's when you finally realize that your voice, your time, and your choices truly matter. So as we close today, I want you to remember this simple truth: you are the expert on your body. No test, no doctor, no machine can understand what you feel, what you value, and what kind of life you want to live better than you do. Trust that wisdom, protect it. Let it guide every decision you make from this day forward. Because this, right now, is your golden life, and you deserve to live it, not in fear, but in freedom.